My first guest is Dr. Tom Schwarcz, who is a vascular surgeon with Lexington Surgeons. Welcome.
Thank you. Glad to be here.
All right, when we say vascular, it's circulation, and a lot of the patients I see think the circulation is related to the veins and the things they see in their legs, and they say, you know, Doc, can you get rid of these? And I say, well, let's ask Dr. Schwarcz. Tell me about varicose veins.
Well, actually, most varicose veins do cause some symptoms, at least the ones that most people see that are bulging and obvious on the legs. They can cause swelling, pain, discomfort, itching, aching, burning. And not only that, they can also cause damage to the skin, which ends up being a much more significant problem.
So not all treatment of varicose veins is a cosmetic deal, it's actually a medical deal.
In fact, most treatment is probably medical because we try to prevent the consequences of swelling, we try to prevent infections, we try to prevent the skin damage that happens from long-term problems with varicose veins.
So how do you know if they need to be treated? How do you know if it's cosmetic or if it's a real problem?
Well, the best way to figure it out, if you have obvious varicose veins, is to have an ultrasound. And you have to have an ultrasound in a vascular laboratory that actually specializes in mapping out problems with valves in veins. Because what we look for is to see where the veins have problems, and that allows us to determine the appropriate treatment.
So it's important, at least when you get the test, you're getting it in a place that knows what they're doing.
Exactly, and there's actually an accreditation system for that, and you should ask for a location that's accredited and actually has registered vascular technologists who are certified to do the testing that they're doing.
So if you have a medical problem, or actually if you have a varicose vein problem, what's the treatment options?
Well, the treatments have gotten much better in the last 10 to 15 years, and we don't even do the old vein strippings that everyone's heard about. We just don't do them anymore. What we do is an endovenous ablation procedure, usually with a laser fiber for the main veins that may have valves that don't function and feed all the branches that are large and bulging. And if the bulging veins and the branches don't go away, we can do a microphobectomy, which is pinhole incisions, and you use hooks to just extract the veins so they're gone.
And that's an outpatient procedure?
All of this is outpatient. We actually do the laser procedure in the office under local anesthesia. The microphobectomy procedure with the pinhole incisions and hooks is done in the outpatient surgery center, so you don't even really go to a hospital to get treatment. It's all outpatient, no scars, no problems afterwards.
Well, what are some things you can do short of an invasive procedure? Are there other things you can do to treat the symptoms?
Sometimes people will get some benefit from wearing stockings, actually prescription compression stockings. Now, the stockings don't make the veins go away, but they push back on them and don't let them fill with blood, and so your leg might feel better for a while.
Now, if we're going to put up on the screen some pictures of before and after, because it does really make a difference.
It's remarkable how good the treatments are now, and basically you can get rid of any large bulging veins in your legs.
Insurance, is it a cosmetic? Is it a covered procedure?
If patients have symptoms and the ultrasound demonstrates that they have problems with the valves and the veins, it's a covered procedure for most insurance policies. Now, insurance policies do vary, and for the most part they will make you wear compression stockings before treatment, and they are part of the treatment afterwards for 2 to 4 weeks.
And short of treatment, is there anything you can do to prevent a varicose vein, or is it just genetics and it happens?
I think you can thank your parents and your family for them.
Okay. You also mentioned skin. Tell me what happens when you get is it a varicose ulcer?
You can actually get ulcers. They're called venous ulcers, but they're from high pressure in the veins. It leads to seepage of fluid under the skin stretches out, it gets scarred. If it gets scratched or damaged, it won't heal, and you'll get these open sores.
And so you want to treat the varicose vein before you end up with that kind of problem?
Very much so, very much so.
Now, you also do a little bit on blood clots. You can take care of those, you can diagnose those, but it's a totally different thing than a varicose vein.
It is totally different and involves usually the ones you're concerned about are not the superficial clots, but they're the deep veins that get clots. And the treatments have also advanced tremendously in the last several years. And what we do now is called this thrombolysis, where we actually put catheters in the deep veins and dissolve the clots. And the results are very impressive in terms of decreasing the long-term problems that patients may have with their legs.
Well, that's great information. And here's a Health Talks brought to you by Baptist Health, where Dr. Schwarcz summarizes vein treatment.
A varicose vein is one that has lost the ability of its valves to hold backwards blood flow. And so what happens is blood will actually go backwards down the vein instead of being held in place and go back up to the heart. Well, there are two main treatments for varicose veins. One is this endovenous ablation, where you put a laser fiber into the main surface vein of the leg and then numb up around it and actually burn the vein so it forms a scar, and you can no longer get the backwards flow down the leg, which causes the problems in the skin and lower down in the extremity. The other major procedure is microphlebectomy, where you use little pinhole incisions and hooks to take the actual branches out so they are completely eliminated. And frequently, patients will need a combination of both those treatments for complete treatment.
We evaluate the deep system and the superficial system in order to give the physician the information they need to treat the patient.
It's very important to determine where the problem is with the veins, and we use duplex ultrasound to do that. And duplex ultrasound is very effective for mapping out where the problems are in the varicose veins, where the valves don't work, and which branches have what problem and why they have the problem. Based on the ultrasound mapping that we do, we determine if you need an endovenous ablation first, or you need a microphlebectomy only, or need the combination of the two. Both treatments, endovenous ablation and microphlebectomy, are virtually painless. They're done without stitches, and there are no scars left after the treatments. Truly a tremendous advance in management of varicose veins.